I'm going to be discussing antibiotics and their modes of action. First, I want to discuss the 5 modes of action of antibiotics. We have the cell wall synthesis inhibition, disruption of cell membrane function, protein synthesis inhibition, nucleic acid synthesis inhibition, and action as antimetabolites. The cell wall synthesis inhibitors typically work by inhibiting a step in the synthesis of the peptidoglycan layer. By inhibiting the synthesis of peptidoglycan, these antibiotics are selectively toxic because eukaryotic cells lack cell walls, thus don't have a peptidoglycan layer. And it's really good for antibiotics to work this way. When they're selectively toxic, it will kill the bacteria cells, but it won't kill the eukaryotic host cell, which is really what we're looking for. The cell membrane disruptors are antibiotics that work to disorganize the structure of the cell membrane or inhibit its function. The cell membrane plays a vital role in cellular processes, so disrupting its function is detrimental to the cell, and it cannot survive. The protein synthesis inhibitors attack at the ribosome and typically inhibit a step in translation, which prevents the protein synthesis. They will typically have a higher affinity for binding to the 70S ribosomes, which are not found in eukaryotes. The eukaryotes have 80S ribosomes. So this makes these selectively toxic. Some antibiotics will bind to the 50S subunit of the ribosome, while others will bind to the 30S subunit. Nucleic acid synthesis inhibitors. Most of these work by inhibiting enzymes that are required for bacterial DNA synthesis. They can also affect RNA synthesis. By inhibiting the DNA synthesis, they are effective at killing the bacterial cells, but most of these drugs are not selective, which makes them unable to be used clinically. So it's not much use to us if they're killing off our cells as well as the bacterial cells. And lastly, we have the antimetabolites, which also act as competitive inhibitors. They work by interfering with enzymes or reactions that are needed for DNA synthesis. So they'll typically act as a substitute for the actual metabolites that would normally be used in metabolism. So they'll come in and competitively bind instead of the normal enzyme. And these are typically the sulfa drugs that work this way, and they're very useful in fighting urinary tract infections. And an example of this would be Bactrim. And then we have 5 major classes of antibiotics. First, you have the beta-lactams, which include your penicillins and cephalosporins, the macrolides, the fluoroquinolones, tetracyclines, and aminoglycosides. Beta-lactams, like I said, include the penicillins and cephalosporins. They're considered to be a broad-spectrum antibiotic, and they contain a beta-lactam ring in their structure. They're typically bactericidal, which means they directly kill the bacteria, and they work by inhibiting the synthesis of the peptidoglycan layer of the cell wall, which makes them cell wall inhibitors. Some common drugs in this category would be cephalexin, ceftonir, amoxicillin, penicillin VK. The amoxicillin and penicillin would be your penicillin derivatives, and then ceftonir and cephalexin are the cephalosporins. And these drugs are commonly used to treat infections such as strep, respiratory infections, and ear infections. The macrolides are bacteriostatic antibiotics, meaning they inhibit bacterial growth and reproduction. And they work by binding irreversibly to the 50S subunit of bacterial ribosomes, which will inhibit the production of proteins. So they fall into the protein synthesis and inhibition category. Some common drugs would be the azithromycin, clarithromycin, and erythromycin, and their common uses are for respiratory infections, gastrointestinal tract infections, and soft tissue infections. Azithromycin is a really common one seen if you've ever had a sinus infection and gotten a Z-Pack. That's what that one is. The fluoroquinolones are antibiotics that work by inhibiting activity of DNA gyrase and topoisomerase enzymes, which prevents DNA replication. So these would kind of fall into that category of the nucleic acid synthesis inhibitors. And some common ones that are used are ciprofloxacin, levofloxacin, and ofloxacin, and they're commonly used for sinusitis, bronchitis, and pneumonia. These are generally used for more resistant strains of bacteria rather than regular treatment because they can have more severe side effects. So if you can knock out the infection with something like azithromycin or amoxicillin, you'd be better off using that with less side effects than trying to go to one of these that could cause more severe issues. Next we have the tetracyclines, and these antibiotics are protein synthesis inhibitors, and they work by inhibiting the binding of tRNA to the mRNA ribosome complex. So they prevent that tRNA from coming in and bringing the amino acid to link to form the chain, which then forms the proteins. So they mainly bind to the 30S ribosomal subunit, and some common drugs are doxycycline, minocycline, tetracycline, and they're commonly used for skin infections like acne, intestinal infections, as well as STDs. And then lastly, we have the aminoglycosides, which are antibiotics that also inhibit protein synthesis. They will bind to the 30S ribosomal subunit as well, and they cause a misreading of the genetic code. And then some common drugs are gentamicin, topramycin, and neomycin. And these are mostly used for eye and ear infections. And then they're used also for other gram-negative bacilli bacterial infections, but most commonly the eye and ear infections. And they come in a drop form. And that's it.